So we did a study of a large group of patients, women diagnosed in Detroit and Los Angeles, recently diagnosed in 2005 to 2007, to evaluate how decisions are made around two critical surgical decisions, which is mastectomy versus lumpectomy, primary surgery, and breast reconstruction. And fundamentally what we wanted to know was, does it matter where you go? Do women with similar characteristics get different kinds of treatment based on where they go, rather than their differences in their preferences and characteristics? The two decisions are very important because lumpectomy versus mastectomy is a critical surgical decision that women have to make, and for the past 20 years there's been some concerns that mastectomy has been overutilized in the United States, and it may matter where you go with regard to the kinds of surgeons that you see. Breast reconstruction is also a very important issue because there's some concern about underuse of reconstruction in the population, and that there's an issues of access or information may result in women not getting that kind of therapy versus the other kind of therapy available for breast cancer. So we did a large study of women in Los Angeles and Detroit, and what we found out was, with regard to mastectomy versus lumpectomy decision, that patients with similar characteristics got similar treatment across practices and surgeons who differed by their experience or the number of surgeons in the practice and how doctors relate to each other. But for reconstruction, we found a very different finding. We found that women with similar characteristics were there was lots of variability in terms of the kinds of, whether they got reconstruction or not. And this could be based on a number of different factors. But the most important factor was whether that plastic surgeon was at the table at the get-go, at the earliest time of decision-making with regard to any of these therapies. One thing about breast reconstruction is it's a very important decision that's very intimately a patient preference. And it's a complicated decision. The different options are complicated and require a lot of discussion. And sometimes that discussion can fall off the bandwagon because of all the other treatments that women have to make. So it makes some sense that the plastic surgeon up front in the decision making may make a real difference in the access to and utilization of that procedure. So what we found is that in practices where the plastic surgeon was involved at the very earliest time, generally for their patients, that those patients were more likely to get breast reconstruction. And what this means for patients is, with regard to mastectomy versus lumpectomy, patients should be confident that they can walk into an office in these areas of the country and they're going to get a fairly similar and uniform discussion, because it appears that surgeons have a consensus regarding the approach to the management of patients for that condition, and that patients are getting a uniform discussion. But with regard to reconstruction, I think patients should be aware that the role of the breast surgeon in the earliest time of the decision making is uncertain, and that they should make sure that the surgeons that they see, that a very uniform discussion, a very deep discussion about breast reconstruction is implemented at the earliest time, so they can know where that procedure and treatment sits when their palette of the treatments that they need to get with regard to breast cancer.